Welcome to Understanding How to Navigate the Health System, a guide for citizens. My name is Christina Madison, and I'm a scientific lead at the McMaster Health Forum. I'll be walking you through this module. This course is prepared by the McMaster Health Forum and is supported by the Ontario SPOR Support Unit. There are 6 modules in the course: Introduction, Care for Select Conditions, Care for Select Treatments, Care for Select Populations, the building blocks of the health system, and conclusion. The majority of the content in this course has been referenced from the book Ontario's Health System: Key Insights for Engaged Citizens, Professionals, and Policymakers. The book is available as a free download at the URL provided below. Along with myself, the course will include videos from citizens, professionals, and policymakers to help guide you through the content. Let me pause and let them introduce themselves.
I'm John Lavis, the director of the McMaster Health Forum and editor of the book Ontario's Health System: Key Insights for Engaged Citizens, Professionals, and Policymakers. Through brief videos like this one, my colleagues and I will highlight the important takeaway messages, and Lydia will provide a citizen's perspective, David Price, a health professional's perspective, Heather Bullock, a policymaker's perspective, and finally Ahmed Ali, a researcher and student's perspective.
Hello, I'm Heather Bullock. I'm a PhD candidate at McMaster University in the Health Policy PhD program. Throughout my career, I've held several policy positions, including one at the Ministry of Health and Long-Term Care as Research Transfer Advisor.
Hello, my name is David Price, and I'm a family physician, and I'm chair of the Department of Family Medicine at McMaster University and chief of the Department of Family Medicine at Hamilton Health Sciences.
Hi, my name is Ahmed Ali, and I'm a PhD student in the Health Policy program, specializing in political studies at McMaster University, under the supervision of Dr. John Lavis.
I'm Mike Wilson. I'm the Assistant Director here at the McMaster Health Forum. I'm also an Assistant Professor in the Department of Health Evidence and Impact at McMaster University.
This course refers to citizens. Our definition of citizen includes the taxpayers who finance much of the health system, the patients who receive care in the health system, the family and other caregivers who support patients receiving care in the health system. We do not mean just those who hold Canadian citizenship and live in Ontario. This course is developed to help citizens understand how the Ontario health system is structured and how it works. The modules are designed to explain how care is delivered in Ontario and the building blocks upon which the system is based and functions. Understanding your health system helps you to navigate the system and also to be able to advocate for changes that would improve the system. There is a companion course called Finding and Using Research Evidence, a Guide for Citizens. That course gives you the information and tools needed to find the high-quality evidence to answer questions you may have about your personal health or that of your family, about the health of your community, about the health system more broadly. You can find this course on our YouTube channel. This new course will give you a deeper understanding of the health system and also how you can use high-quality evidence to advocate for change to improve it. Everyone has health-related concerns. We rely on the health system to address many of these concerns. Understanding the design and function of the health system will help you to get answers for your concerns and to advocate for change when necessary.
The Ontario health system is largely the responsibility of the provincial government, particularly the Ontario Ministry of Health and Long-Term Care, though other government ministries play roles in funding and decision-making for some sectors and conditions. The federal government also plays a role in the health system, albeit a much smaller one, for example by providing some funding to the provincial government for medically necessary hospital-based and physician-provided care, and by setting out the 5 principles under which insurance for such care is provided. An arrangement dating back to when hospital insurance was introduced in the 1950s and medical or physician insurance was introduced in the 1960s means that hospitals have remained private, not-for-profit organizations, and physicians continue to work in private practices even though they are largely paid by government.
Healthcare in Canada is mainly paid for by its citizens, delivered by non-government people and organizations. Services for the purpose of maintaining health, preventing disease, or diagnosing or treating an injury, illness, or disability are guaranteed for all citizens. These are called medically necessary services. These services are guaranteed whether they take place in a hospital or in a doctor's office. There are 14 health systems in Canada, 13 provincial and territorial systems, and 1 federal system for Indigenous peoples on reserve, the military, and federal inmates. Each of these systems does things a little differently. For example, they each decide what services are medically necessary. The federal government determines the rules of the system. These rules were determined through the Canada Health Act. Each province and territory is responsible for delivering healthcare to its citizens. They interpret some of these rules established by the federal government and make sure that healthcare in their province or territory follows these rules. If they follow the rules of the federal government, then they will receive financial support. Within Ontario, the Government of Ontario is largely responsible for the Ontario health system, within certain broad rules set by the federal government. Care is increasingly being organized by region, with each region overseen by a local health integration network. Ontario is divided into 14 LHINs. Each LHIN plans, integrates, and funds local health care. Medically necessary care provided in hospitals or by physicians is covered at the point of use. Prescription drugs are paid for by government in whole or in part when provided as part of home care, in a hospital, or in a long-term care home. Otherwise, only if eligibility criteria are met for government programs, for example, the Ontario Drug Benefit Program, will they be covered. In Ontario, we now spend more money on prescription drugs than we do to pay physicians. Ontario has approximately 13.5 million people. The average cost to the health system for each Ontario citizen is $4,869 each year. That comes to a total of $65.7 billion and is the largest provincial expense. 2/3 of the money comes from the government. 1/3 of the money comes from private sources like employer health plans or out-of-pocket charges to citizens. One of the building blocks of the system are the many financial arrangements it has to deliver health care. Public spending, in other words, government spending, on healthcare in Ontario is mostly financed through taxes. Private spending is financed mostly through out-of-pocket payments by citizens and premiums paid to private insurance plans. In other words, the Ontario health system is paid for by its citizens and its employers.
While healthcare in Ontario is often considered free, it is more accurate to refer to it as free at point of service, because Ontarians pay for healthcare either through their taxes or through private channels such as employer-sponsored insurance premiums. This money is distributed to organizations like the Ontario Health Insurance Plan, which is responsible for paying physicians for the services they provide. Many physicians are paid a set fee for each service they provide, an approach referred to as fee-for-service. The money collected to pay for care is also allocated to organizations like the 14 local health integration networks in Ontario that allocate funds to pay for services provided in hospital and by other organizations. These organizations in turn pay a salary or hourly wage to the health professionals, such as nurses, who work in them.
The Government of Ontario uses different sources of tax to finance the health system, including income tax, sales tax, and corporate tax. Federal contributions in the form of the Canada Health Transfer and the Canada Social Transfer are also used by the Government of Ontario to finance the system. Over the past decade, total government expenditures on the health system have increased, although current trends suggest that the amounts spent per person in total are likely to remain constant or even decrease slightly in the coming years. While the Government of Ontario accounts for the majority of health spending in the province, the federal government pays for the programs, services, and drugs needed by select populations, such as First Nations communities and military personnel.
The largest share of public dollars spent on healthcare is used to fund hospitals, community care agencies, and other organizations through transfers to local health integration networks. The second largest share is spent on physician services through transfers to the Ontario Health Insurance Plan, or OHIP. Many physicians are paid a set fee for each service they provide, but up to 1/3 of all income received by physicians in Ontario is now paid to them in other ways, particularly true in primary care. Other health professionals, such as nurses, are typically paid through salaries.
Government spending, which is typically called public expenditure, accounts for roughly 2/3 of the money spent on healthcare, and private spending, like insurance premiums and out-of-pocket payments, makes up the rest. The provincial government spends about 43 cents on the health system out of every dollar, with the three largest public expenditures being hospitals, prescription drugs, and physicians. The government pays a very high percentage of the care provided in hospitals, about 99%, and a high percentage of the care provided by physicians, about 85%, whereas it pays for a smaller percentage, sometimes a much smaller percentage, for care provided in other settings or by other health professionals.
All Canadian citizens and permanent residents are covered for those healthcare costs paid for by the government. Care is provided based on need and not your ability to pay. Ontarians, especially women, tend to live long lives. Many factors beyond the health system contribute to long life expectancy. Cancer and heart disease are the most common causes of death.
Ontarians generally have relatively good health, with an increasing number of individuals living well into their 80s. There are, however, many differences in health status across the groups, including groups defined by their income or education. Medically necessary care provided in hospitals and by physicians is free at the point of service for all Ontarians. But this isn't the case for care provided in many other places or by many other health professionals. Ontario is very large geographically, and accessing care can be challenging in many rural, northern, and remote communities.
To understand the health system, you need to understand how care is organized in situations that are not typical or common, such as what conditions require unique care, how care is delivered outside traditional hospital settings, who receives care differently, and understand how to navigate the system. This is the end of the module. Up next, we will now review how the Ontario health system delivers care for different health conditions.